Corningstone, and this is a special report addressing the effects of the popular drug prednisone. I feel that our viewers need to be aware of all the effects of this drug, and investigative reporter Tally Stothers gets down to the truth with Miss Gertrude Finkmeister.
Well, I have this condition called rheumatoid arthritis, and it's very difficult for me to get up and down the stairs without assistance or pain. And then my doctor told me about this drug, and it's like a miracle drug, and now I have no aches or pains or any stiffness in my joints. But come to think of it, I'm always getting sick. And then my doctor said I should get a vaccination for the swine flu. And I guess I'll take his advice because I just can't afford to be sick these days.
So Miss Finkmeister gave us a great example of her success story as well as the consequences associated with prednisone. Let's hear from another person in their story.
Well, obviously, I have asthma. Okay, I almost couldn't breathe last week, but I've been taking prednisone, so that's really helped much. And now I can hold my bunny sugar, okay, and sugar. Anyway, and last week I looked like a squirrel, okay? My cheeks were full of it looked like nuts were stuck in my cheeks. That's how big they were. And if you could have seen my arms this morning, but then I shaved, okay? I shaved, so I was real hairy-like. See, and the doctor said there's like side effects or something, but I don't even know if it's worth it, okay? And then I was in my bedroom this morning, and my sister was like, Raynell, come out. And be like, I could not because I was crying. I was so depressed, okay? And I just want to say to everybody out in America, I want to say, hide your wife, hide your kids, and hide your husband, because they're giving this drug to everybody out here. And this drug is so dumb. It is really, really dumb, okay?
So it sounds like we have some conflicting views about the drug prednisone, which is a major concern for our public. I have here Dr. Ingrid Mitchell, who is the co-author of the book Surviving Prednisone. Her background is in pharmacology, and today she's going to talk to us about the safety and efficacy of the drug. So welcome to the show, Dr. Mitchell. In your expert opinion, can you tell us about your thoughts on prednisone?
Yes. Well, prednisone's been around for many, many years, and many thousands of people have taken it. It's a synthetic form of cortisone, but 4 times more potent than the naturally occurring form of it. It is used for both acute and chronic inflammation and immunosuppressive effects. Uses include anti-inflammatory treatments for asthma, allergies, rheumatoid arthritis, inflammatory bowel disease, skin disorders, and leukemias. It's used immunosuppressively for organ transplant, rejection, and cerebral edema.
So it sounds like there are many positive aspects of this drug. Are there any side effects?
Yes, with any drug, it affects people in different ways. Some of the minor ones we can expect are depression or a sense of euphoria, headaches, fatigue, muscle weakness, fluid retention, increased levels of cortisol, a Cushing's disease-like appearance. Children have a problem with decrease in growth, osteoporosis, loss of electrolytes, acne, impaired skin disorders, and hypertension. More serious side effects are decreased immune system, atrial fibrillation, increased blood glucose levels, cataracts, glaucoma, primary adrenal insufficiency, peptic ulcers, and thromboembolism or thrombophlebitis.
Who is unable to take this drug?
Pregnant women definitely should not take this drug. It's a Class C drug, and it also gets into the breast milk, so breastfeeding mothers should be cautious when using this drug. And also people that have a systemic fungal infection should not use this drug. Also people that have hypertension, myasthenia gravis, GI disorders, diabetes, and it may exacerbate the problem.
In general, how does someone at home take this drug?
Well, the nurse should monitor the patient's blood pressure, the electrolyte panel, because you might lose some electrolytes, blood sugar level, mental status, get eye exams frequently, signs and symptoms of infection. And for kids, they should definitely be monitored for growth patterns. You should always consult your doctor before you get any immunizations, and stay away from chickenpox and measles exposure. Diabetic patients should definitely tell the doctor if they're having a trouble with their blood sugar control. And just the basic no smoking, alcohol, it might increase the chances of osteoporosis.
All right, thank you for your time, Dr. Mitchell, for describing prednisone to us. And I'd like to thank all the viewers for tuning in with us this evening. Stay classy, Anchorage.